The pandemic's been tough on all of us as we're all learning to do things differently. But for many new moms, it can be a hard time because not only are you dealing with a new experience, you're also having to adjust to what you had imagined it would be like.
Yeah. What kinds of fears do they have? What kind of advice are medical professionals giving them? Morning anchor and health reporter Kristen O'Connor is standing by now to ask a doctor.
Well, becoming a new mom for the first time can be stressful when we're not in a pandemic, but now there are a lot of changes that have women worrying. So I set up a Zoom call with birth coordinator and lactation consultant Kristen Sorondo from Oviedo Medical Center to find out what the questions are all about.
I have had more phone calls in the last 6 months than I have the entire time I worked here. Everybody is constantly asking questions. What are you doing at your hospital? What are some of the policies? How can I prepare? Because, I mean, typically when a mom is pregnant and they're going through pregnancies, there are classes that they're taking. There's, they're doing their baby registry, different things like that. And they're all kind of at home right now and not really able to do a lot of those things. So we do get a lot of moms that are just concerned in general. You know, they're flipping out that only one person can be in the delivery room with them. And, well, I can't have a doula, I can't have a support person. And then, my birth registry and, virtual baby showers, it is all kind of like, not only was it new in general, but it is like really new. And like, even, the community is new. So it's kind of like, they're not sure where to go for information anymore.
Sorondo says only being able to have that one support person is a big area of concern for a lot of new moms, and that change in the policy has also changed her job a little bit.
Well, I think that I am definitely more of a counselor these days because they are so anxious. How we are doing it here is you're still allowed to have one support person of your choice. So just trying to make sure that moms are still prepared. So referring them to maybe places that are doing virtual classes. So if they are, wanting a particular class, I have no idea what to expect during labor. Okay, what resources can we give them? What videos can we have them watch just to kind of somewhat be prepared? I've never taken care of a baby before. What do I do? Again, let's try to find you some resources of videos that you can watch or information that you can read just to try to help you be as much prepared as possible coming in with that scenario.
Still, Sorondo says the most important thing is for new moms to have people that they can count on and be in their corner, ready to help if you need them. You don't need to do everything as a new mom all by yourself.
When you have a baby, definitely you need a support system. And I feel like they're the ones that are calling and having more concerns, just needing a little bit more guidance because they might not be letting grandma and grandpa come over, or their mother-in-law or father-in-law come over because maybe they're older. Maybe they don't want them to expose the family, to expose the parents, or the parents to expose the baby, and then limiting all of the people that are around. So when you don't have that family support that most people are used to, that even, makes things even more complicated.
Of course, if you have any questions or concerns, you can always reach out to your own doctor's office or the hospital or birthing center that you're planning to deliver to see what resources they may have available to you.